Thanks, Esther. This is a big crisis indeed. We are experiencing an increase in mpox new cases in the country. As of August 26th, around 18,000 suspect cases have been reported, and around 4,800 confirmed cases, and 600 deaths. Most affected are children and adolescents, likely due to the household transmission. And the most factors that are making worsen the situation are the fact that DRC is experiencing the armed conflict, mostly in eastern part, in south and north regions, but also around 1.3 million as of today are IDPs, the internally displaced persons. And with the weak immunity, that can help us, lead us to anticipate that people living with HIV and children are mostly affected, and malnutrition is playing also a key role on that.
Right, Doctor. You mentioned, concern about women, and we understand there are also children living with HIV and AIDS as well in those areas of conflict zones. But why is mpox particularly dangerous for this group of people?
Oh, this is very, very, very dangerous because there are evidence that show that this group is very most vulnerable. For instance, particularly for women, in pregnant women, there is a study that evaluated maternal outcome in pregnancy and the complications that reported 34.3% of fertility cases in pregnant women with mpox. This means that this increased the likelihood of death by twofold. Mm-hmm. And miscarriage and preterm at 39.9%, around 40% of this complication, and vertical transmission, mother to child, has been also reported. So there is a lot of...
Doctor, very quickly, let's address, I understand that there was a meeting between you medical doctors, the DRC government, and also WHO to come up with an action plan to help DRC combat the mpox. What more can you tell us, maybe very, very briefly?
Actually, there are a lot of meetings and consultations going on. The government, the WHO, and other stakeholders are working mostly to get vaccines provided to the country. And we were expecting some doses already that had been delayed. Actions are actually aligned with the WHO recommendation, including strengthened surveillance, enhanced scale-up and equity access to the medical care. And as you may know, we are putting into actions prevention measures, as that have been implemented also for COVID, but specifically adapted to mpox.